Hello, everybody. We all know that March 8th is celebrated as International Women's Day. And the very fact that there is a Women's Day means there is something to focus on women, womanhood, the contributions they make to the society, at home, at workplace, and the challenges they face, and how to make things better for today's women and tomorrow's women. So today we have two doctors, Dr. Pooja Mallya, consultant in Paediatric Hematology and Bone Marrow Transplantation, and Dr. Akshata Nayak, consultant in adult hematology and bone marrow transplantation. This field, hematology and bone marrow transplantation, whether it is pediatric or adult, is a very challenging field. A challenge that not every field in medicine faces. And it is many of the challenges are hidden. The doctors in other fields themselves don't know about the challenges that we face. Forget about the gender discrepancy. So we have, as women, the challenges are extra. The work hours, the emotional pressure that we go through, plus our own priorities poses a lot of challenges. So this is about the doctors. And the patients and the patient caregivers also, as women, face a lot of challenges. So today we'll discuss about these few things to make things better, to pave the path for our generation as well as the future generation, and hope this discussion will throw some light on the challenges that we face. Dr. Akshata.
Yes, ma'am.
Yeah. So you come across a lot of women in your field,
yes,
who are diagnosed with various conditions. You come across men also. So are there certain conditions in hematology, that is blood and cancer related diseases, which are unique to women or more common in women?
Yes, definitely. The anemias are very common in women, and especially iron deficiency anemia is very common in the menstruating age group, the reproductive age group, and also the perimenopausal age group. Most of the times it's neglected, and they come to us, when the hemoglobin is really low, because of lack of awareness. Also, as a society, the girls, there's a differentiation, in the diet given to the girls compared to the boys. So same thing continues in adulthood also. So nutritional deficiencies also contribute to anemias. In addition, autoimmune conditions are common in women. So autoimmune hemolytic anemias, immune thrombocytopenias are also common in women. Bleeding disorders like von Willebrand disease is common in women, especially in the menstruating age group. When it comes to cancer, the incidence is more or less similar among males and females. But yes, anemias are very common in women.
So Dr. Pooja, anything in pediatric like this?
I think it's almost similar, because anemia is a very common thing which is seen in infancy as well as in adolescent period. And in infancy, it's almost similar. The incidence in males as well as females is almost the same. But as they grow in adolescence, once they start their menstrual cycles, definitely they are more prone to have iron deficiency anemia. Also, I agree with Dr. Akshata that autoimmune diseases, including autoimmune anemia as well as thrombocytopenia, is common. Based on cancers, there is a little bit of more predominance in males as compared to females, but the difference is not much. And there are certain disorders which are X-linked. So we'll have many patients who are males who are more affected, especially in younger children where you have G6PD or hemophilias. They are very much common more in males as compared to females.
So getting diagnosed with some kind of a blood disorder or cancer is shocking by itself, whether it is a girl, boy, man or woman. But is there any difference in the impact that a woman has when compared to men?
Yeah, definitely. The word cancer itself creates a lot of fear, not only in the patient but also in the caregivers, and it's difficult to digest initially. When it comes to women, usually we categorize, the unmarried women and the married women. The unmarried women, the main fear is the word cancer itself, brings down their prospects of getting married. They fear that they'll remain single. There'll be loss of looks, loss of hair, worse, a social stigma is associated with the word cancer. And if you're an unmarried lady with cancer, definitely it's proportional. Okay. And in addition, the fear of losing jobs, When it comes to married women, again, we are like, if somebody is a homemaker, they'll be dependent on their families. There is familial discrimination. And if somebody is working, there's a fear of losing financial independence, fear of losing job. And if it's a married woman with kids, she's always under this constant threat. In case she loses her life, what will happen to her kids? Will they be orphaned? And if somebody is not having kids, the fear of separation from spouse, divorce rates are high. These are the fears.
And the
women
fear
go
of
through.
remaining infertile, not not able
Infertility
to
is
have
also
baby
there.
at all in
Right.
their entire
Correct.
lifespan.
Correct.
Yeah, right. So unique problem. Probably they may not be able to speak about it.
Right. Most of the times they don't speak, and some of them open to me because they kind of okay, maybe it's easy to open up to a lady. So this is what we usually see, commonly see.
So, Dr. Pooja, I'm sure the problems are different in children. 18 years and below are considered as pediatrics. So, what in your experience, is the impact on these age group?
Yeah, especially girls, because in their adolescent period, this is a period where they are very conscious about their body. So during therapy, they have to face a lot of challenges. One is that their looks change, their body changes. So first thing is, because of the treatment, they may lose hair. Sometimes because of certain medications, they may have extra hair growth. So they can have a mustache, which can make them feel very much, like an alien to the family. And the other thing would be, because of certain medications, either you lose a lot of weight or you put on a lot of weight. And then after you lose weight from that extra weight, you start getting these marks over the skin. So these are actually a very common thing which parents come and ask us whether this will get healed or not. The other thing would be that they are not able to attend school. And this is a very particular age group where they want to mix with their peers. They want to do something in life. So it's a very challenging period to deal with them and try to explain them that this is just a temporary period and they will get well soon and they will be back to normal after this. And there is always this fear, especially in girls, for the parents, that whether they will be able to have children later, whether they will be able to marry someone, because the stigma around us is that if a girl child has cancer, will she be normal, will she still have cancer genes, will it be continuing in the family, if she has a family, whether the children will also get it. So these are certain problems which are very commonly seen in girls and children less than 18 years.
Yeah. And I think if they have to lose a limb or something.
Yes, cosmetically, yes.
Parents are more worried about the cosmetics than the fact that the child will get cured.
Better.
The child is going to get cured of the bone cancer is a lesser worry than the child will get amputated limb or a prosthetic. Right? So, do you actually, both of you, see this in your practice, or it's just a hearsay?
No, it's really common.
It's really common. And how about the social strata? Does it differ in educated people, financially well off? Does this discrepancy differ in the social strata?
Yeah, I think if people are, we have been seeing people who come from all stratas of, the people who come here from lower socioeconomic status and people who are very educated. I think education matters a little bit because sometimes the girl child is neglected, maybe to get her at the first diagnosis or at the first hint of knowing that she's unwell. So sometimes there is some kind of delay for her to be brought to the hospital. And as Dr. Sobha said, that if we are going to tell a girl child that you are going to lose a limb, maybe they will prefer to just stop the treatment and let the child be, because they're more worried about a future and they don't realize the seriousness of this. But I think now things are changing and people are getting educated. People are no more thinking of girl and boy, and people are moving forward.
That's a very good comment, Dr. Pooja, and it's really, we can be hopeful of many things. So that's about the patient. How about the caregivers? It must be very stressful for a family when there is a loved one going through treatment for cancer. Dr. Akshata, do you see any different kind of burden on women just because they are women? A female caregiver.
Yeah, definitely. Most of the times when we see our male leukemia patients, lymphoma patients and their wives, we kind of, we can see it on their faces, okay? They are, otherwise also they are supposed to be having a lot of responsibility. Now the responsibility quadruple, because now the cleanliness is to be taken care of, the food, the type of food which has to be given to the patient. Emotionally, they have to be strong. They cannot show their emotions in front of the patients because they have to keep the patient also strong. Sometimes, this can lead to burnout unless, responsibilities are shared. But problem in India is, the diagnosis is most of the time it's hidden. So they don't tend to get the support which is actually required. You
So
require a
probably
lot of
they,
support.
because of the social stigma, they are afraid to tell anybody.
Right.
And not telling anybody means not getting any support.
Right.
Yeah.
That is when it comes to homemakers. But if some caregiver is also professional, she might have to cut off, move away from a professional life, and that means there's a fear of losing jobs, the fear of having financial security, additional financial security to support the patient's treatment, that is gone. And in case she continues, somehow manages to work and take care of the patient, the performance status goes down. There's a fear of losing job. So that's very evident.
And probably this kind of losing job is more for women than for men. If there are two people working and somebody has to compromise in the job, it's probably the woman in the family, right? Dr. Pooja, do you see if a child is affected with cancer, parental responsibility is parental responsibility, but do you see any difference in the caregiving or caregiving responsibility?
Because these are children and they're less than 18 years, they will be dependent. We cannot totally rely on the child that he'll be able to take care of many things. So he will definitely require a parent. And most of the time it will be the mother who takes that responsibility. And if the child is younger, especially if the child is less than 5 years, there are a lot of things. The child will be totally clingy to the mother. So be it emotional support, be it feeding the child, be it hygiene, be it managing the child during difficult treatments, it will totally come on the mother even though the father is around. So that responsibility definitely comes in. And in few areas and in our country especially, what happens is there is this social factor of the cancer has probably come from the mother's side. Maybe the mother didn't do something right for the child, and so the child has got cancer. There have been cases where because of this, there has been, the husband has left the family and gone, and the woman is alone taking care of this. So along with the social and emotional problem, plus the physical energy she has to put in, she also has to take care of finances. And just like an adult caregiver or for an adult patient, if you have a working woman, she would have to give up her job. And the beauty of the things now in COVID is a lot of things are online, and I think because women are now too good at managing many things, they are trying to manage it online. But I definitely agree that this is extremely stressful to manage a child who's not well as well as do your work.
Yeah. So that's, I know, COVID. I mean, it is, I would say, I don't know how people would perceive if we say it's a good thing, but it has brought a lot of good changes. And probably we are also seeing certain good changes, like, maybe there are families where cancer is an equalizer. Men do take up responsibilities at home suddenly, and they try to share, but it doesn't happen proportionately in all the families, right? So, Akshata, do you think there are any social groups, either Dr. Pooja, also any social groups, or where do these women affected with cancer or women as caregivers go to if they need any psychological support? Is there any group or anything that they can reach out to?
There are certain hospital-specific groups. Even our hospital has groups for pediatric
Yes.
groups. We are soon going to think of starting one for the adult caregivers too. So each hospital has its own support groups where even caregivers are taken care of. Then there are a lot of online support groups also, like Oncolink India, Hosla and all, which can be looked into.
So we do have support group. That's a message you want to say. And where there is no support group, we can always build one. Is it not? We can always build one. There is a lot of hopes. Speaking up is what is important. Speak out. Whenever you have going through a particular stress, ask for help. Don't assume that it will be given, or don't think that it is wrong to ask. Yeah, right.
There's no shame in asking.
There's no shame in asking, right? So that's about patients and caregivers. We should never forget that one of the caregivers are us, the physicians, right? They are the caregivers at home and bedside, and we are the caregivers medically. So do you feel as physicians, Akshata, how is it different in the field of hemato-oncology for women?
Whenever the women patients open up to us more easily, that's what I've realized. And every time, whenever a patient, lady comes to me, is referred to me with anemia, they're kind of open about it. They find it easy to discuss about their menstrual problems, which they might be kind of not confident when it comes to a male doctor. Some of them, not all of them, but yeah, we empathize more because we have this inherent quality of empathizing,
right? Relating to
them.
Right? Yeah.
So that's why women patients open better to us. That's what I would say.
And over time, I guess even men perceive that, you are more open to not just the medical field, you probe a little more beyond medicine. Right? So I think that's a
listeners,
unique listeners, right? Yeah. Exactly. You put it the right way. Dr. Pooja, what do you think in how have women progressed and in this field of pediatric hematology is very demanding. You are dealing with the entire family, not just the kid. So, how are the physicians in hematology, pediatric hematology?
I think women have gone into every field now, be it our field or any field, but I agree that our field is more challenging. We have a more responsible job than any other field, because we're dealing with children, and children who are going to be on follow-up with us for a very long time, and we are totally in sync with the family. So we treat the child as well as the family. But I think now, because women have understood the dynamics of how we have to manage both work as well as home, we are trying to have a fine balance between work and home. We know how to manage our patients, as well as we know how to give equal importance to our family. We have to take care of our own children, and education for them is also equally important. What is happening now is we have had many mentors now, like in our field of pediatric hemato-oncology, we have Dr. Poorna Kurkure. The hospital where we are, Kiran Majumdar Shaw, has set an example for all of us. So we look up to them, and we also try to see how they are able to manage this balance. And I definitely feel that now, as things are changing, even our peers are able to understand that there are responsibilities which we have to take up as women, and probably our peers who are men need to allow us to have little bit of flexibility at work, which is happening nowadays. But I still feel there has to be a little more progress done. It should be a better environment even for women nowadays. Yes.
And being probably not just flexible and considerate towards women, over consideration is also not good. Oh, she has a lot of responsibility, let's not burden her with additional work. I think we are capable of dealing with both, but at a different pace and in a different methodology. We may not use the same tactics as men, but we still get the work done, right? Getting the work done is what is more important, right? Yes, we have our own pace. Yeah, right, at our pace, right? So Dr. Akshata, do you think there is in the same lines, how can women make things better in this field?
In hemato-oncology, women should come forward and take up leadership roles more, because it's been observed that we are good. Women hematologists have been always good. I have been mentored by my teacher is also Professor Maitri Bhattacharya, and I'm proud of it. So she was my mentor, and she's mentored many lady hematologists, my colleagues, my seniors, and my juniors. Many of us are there. So such leadership qualities are required in. We should come forward and take up leadership qualities. We should be promoters. We are already natural teachers as women, and we should mentor more upcoming lady physicians to take up hemato-oncology. So that's the need of the hour, and obviously, we should support each other. Right.
And probably we have a lot of conferences.
Right.
Take up initiatives, ask questions, and that's what I have seen, that we hesitate to come forward, ask questions, or give our opinion. I think all this will make us more confident, and also help us play a good role to our others who are looking up to us, isn't it? So Dr. Pooja, do you think to achieve all this, whatever we talked about, there are some unique challenges that we face? We have to overcome these. What do you think these challenges are?
First challenge would be that, in India, a lot of things are family based.
Yes.
We need to, talk to our family, and I think both women and girls as such should be able to voice their opinion and tell what they want to do in life. That is the first thing, that is the biggest challenge, I think, nowadays. But now families are very supportive. I can talk about my own family. There's been no discrimination between me or my brother. But I think the same thing has to go through. The other thing would be that a lot of times it is that, that the girl child or a woman will do her basic education, and then the next priority is marriage. So that is taken up as the biggest aim for them. But I think things are changing, and a challenge would be that let her do marriage as well as work, because that is also equally important now. And now with this developing world, we all should have both man and woman working together, because it not only helps the woman personally as well as financially. It reduces the burden in the family. With the growing needs in the society, we definitely require two people working. That is another challenge. The other thing would be that, because the next would be to have a child, and then to manage work and a child is going to be definitely difficult. It's important to seek help of people who can, as well as to have a fine balance between work and home. I think that these are few challenges. And other thing would be that, we need to encourage other women and girls to come forward. I mean, that challenge is biggest, because you have to change mentality of people, which I think for the society is very important. If we have reached at a particular point we have reached what we want to, we need to do something back to them, so that we see these children growing up and doing something which they can do.
So we have to set an example, right? We have to set an example, and I think we are doing that. We should all feel proud of ourselves. We are doing that, and
we have always had supportive families.
Supportive families, and we fortunately have supportive work system to some extent. I don't think it's, we definitely have. We are thankful to all our colleagues, juniors, seniors, contemporaries, everybody. But what I have noticed is women have to also learn certain skills, maybe diplomacy. We have to learn diplomacy, and we have to teach men work-life balance. So I seriously feel that they have to become more assertive when it comes to work-life, and we have to become diplomatically assertive to demand what we think we are capable of. On that note, thank you very much for this session, Dr. Pooja and Dr. Akshata. It was wonderful talking to you, and I hope our generation will see better. We are already seeing better times, and I'm sure we'll see more better times in future. Thank you very much.